Hi, I'm Dr. Lee Caperon. I'm the medical director and CEO of CER Infertility Institute. We are going to talk a little bit about male fertility today and male infertility. One of the things I like to stress about male fertility is oftentimes when people are struggling with getting pregnant, everybody kind of assumes that it's the female, and the reality is that 30 to 50% of the patients that come in our practice who have been having trouble getting pregnant have an issue with their fertility, the male side. And so, it's pretty easy to make a diagnosis of male fertility. We just do a formal semen analysis. The semen analysis that we do here at Caperon is a much more robust semen analysis than you can get over the counter or through mail. We get a lot more information here that kind of allows us to guide you with respect to things that you can do or what appropriate treatments might be. However, the ones over the counter are a lot better than when Kelly and I started doing this almost 30 years ago. They give quite a bit of information, and they're highly accurate compared to what they were 20, 30 years ago. There really wasn't much to offer over the counter, so it's okay to start there. It's also okay for you guys not to be a patient here and to schedule a semen analysis. You just have to call the front desk, let them know that you want to come in. It's a very inexpensive, just a little bit over $100 test to have done, and we can start there on the male side at any time. The other thing that I think is important is everybody says, well, what causes, what are the common things that you see with men who have infertility issues? And one of the more common reasons is some kind of trauma in the past or chemotherapy or radiation. Genetics can play a role, and sometimes we'll need to do some genetic testing if the analysis shows no sperm or a very low sperm count. It's also the most common reason is we don't know. It's idiopathic, and we don't have a good explanation for it. I like to highlight in communications with patients and the public that testosterone use is a very powerful contraceptive. So most men on testosterone have very low fertility potential, and it's so commonly used now for general wellness and appropriately most of the time, but it's not something that patients should be on while they're trying to conceive without having some add-back therapy like HCG or Clomid or things like that, and it needs to be monitored. And so I usually like to highlight in these talks that issue. Also, if you have an abnormal semen analysis, we recommend that you repeat it, or even if it's normal, we recommend that you repeat it. The CDC recommends 2 analyses spread out by a few weeks, and that's what we try to do, 2 or 3 over time. And then if it's abnormal, you need someone who has specialty in infertility treatment to do an exam and probably order some labs for you. We do all that in-house. Caperon Infertility Institute is a little unique. We're the only practice in the state that actually does comprehensive care for the male and the female side. By comprehensive care on the male side, I mean that we'll take you all the way through a sperm retrieval if that needs to be done. So we'll do the exam, we'll do the lab work, we'll do genetic testing. We will prescribe hormone therapy if it's needed. We will also, if necessary, do a minimally invasive procedure here where we actually take sperm out of the epididymis, which is a little collection basket right around the testicle or out of the testicle, and we do that minimally invasive, no scrotal incision. Don't get scared, guys, because very few men need to have that done, with one rare exception, and that's with vasectomy. So if men have had a vasectomy, kind of the easiest way to have a pregnancy is to do in vitro and do a sperm extraction. And again, we do that with no incision. You're up and back to work really within an hour or two. And then the last thing I'd like to touch on briefly is lifestyle changes, lifestyle factors, because people really worry about lifestyle and how that might affect their fertility potential. In general, it's very hard to do anything in lifestyle that profoundly affects fertility potential unless you're a very heavy drinker. Smoking is the one rare exception to that. If you're a cigarette smoker, not really cannabis, unless it's an all-day, everyday event. But it's really not it's not the cannabis itself, it's not the smoke itself, it's the byproducts that are created while smoking that attack the sperm cells. And so most cannabis users have normal fertility potential. Smoking is the exception of cigarettes that does have pretty much in every trial we've ever looked at, there's a lower fertility potential. So if you're a heavy drinker or you're a smoker, those things need to be worked on and modified. The other thing is testosterone use. So if you're on testosterone, it's very common to have infertility. And then real high temperatures can affect the sperm count. It's different in every male. Some men can sauna every day and have a totally normal semen analysis, and some men will sauna once a week. or do hot yoga and have a lower fertility potential because their sperm count diminishes. So there's a different kind of response to temperature in every male, but that can be an issue. And so again, easiest thing to do is get a semen analysis done, whether you do it here or someplace else, and follow up with somebody who knows how to interpret the results of that. Thanks again for tuning in to Caperon Infertility Institute's channel. We appreciate the opportunity to provide some education for you, and don't hesitate to reach out and contact us if you need anything from us.